Hi, welcome to the Destin Business Forum, brought to you by the Destin Area Chamber of Commerce. I'm your host, Amy Perry, and today I have two wonderful people from SimpleHR. Dave Jefferson, you are the Vice President of Operations, is that correct?
Correct.
Soon to be like the Lord and Master of everything, right?
I'm not sure.
No, I didn't say that, Bill. Just joking. And Shannon Cruz, you are Benefits Manager?
That's correct, yes.
All right, and you are here to, talk about
the Affordable Care Act.
All right, our favorite thing, the Affordable Care Act. Before we get into that, though, just for those people who may not know, like there's probably two people in the area that don't know what SimpleHR is. Will you tell us what it is, Dave?
Sure. SimpleHR is a full-service HR outsourcing provider. We're licensed in the state of Florida as staff leasing. And what's unique about our company is we're homegrown here in Destin. Randy Newman put this company together 13 years ago. So very unique, and we provide a full service of HR, benefits, safety, workers' comp, of course, payroll, and accounting.
So you kind of do it all.
We do.
Love that. All right, so now that we know what you do, tell us about the Affordable Care Act. Why don't you just give us a brief, I don't know if there's such a thing, just a brief overview, and then tell me what you want to focus on today.
Sure. So the Affordable Care Act right now is in effect for those employers with 100 or more full-time equivalent employees.
Okay.
Just to go off of that, a full-time equivalent employee encompasses not only your full-time employees, but your part-time staff as well. So if an employer has 50 full-time employees, but 150 part-time employees, we have to take a look at that whole group together. So that's an aspect that, number one, SimpleHR helps a lot of our clients with, and that's a service that we can provide other businesses.
We were talking before the show started, and it seems kind of straightforward, but it can get complicated,
yes.
Especially if you have a lot of part-time employees. So you help with the calculation of
Correct.
that. And then if somebody says, wow, I thought I had, under, because I had 48 full-time employees and 150 part-time employees. If they're over 100, then what? What does that mean for them?
That means that the employer has to offer affordable health insurance coverage to their employees.
Is that an oxymoron? Affordable health? Sorry.
And it also has to meet minimum value requirements under the Affordable Care Act, or pay a penalty. So if the employer, number one, does not offer health insurance coverage to their employees, then they pay a $2,000 per employee penalty, per full-time employee.
Okay.
If they offer coverage and it does not meet the minimum value, so it does not offer minimum coverage, so minimum essential coverage, coverage for doctor's office visits, the deductible needs to be within reason, the out-of-pocket maximum needs to be at a certain amount. So if it does not meet those requirements and the employee goes to the exchange under the Affordable Care Act and receives a subsidy, then that employer is required to pay a $3,000 per employee who goes to the exchange penalty.
So wait a minute, if they don't offer anything at all, they pay $2,000.
Correct.
If they offer something that doesn't meet the requirements and the employee goes to the exchange, they have to pay $3,000?
That's correct.
So it's cheaper just not to offer anything for the employer?
Well, no. First of all, the $3,000 penalty is, number one, if the coverage is deemed not affordable or if the coverage does not meet the minimum value.
Okay.
So if the employer is offering affordable coverage and it meets the minimum requirements, which all of our employers that we work with, we ensure that
they're offering.
Yes, that their health insurance policies do qualify as Affordable Care Act compliant policies.
And we were talking again before the show started about just insurance rates are going up. I think ours was a 58% increase this year. But what's affordable? Is that like a sliding scale, or is there a general, if it costs the employee between $200 and $400 a month, is that deemed affordable? I'm not gonna, it's not a test, but just is there a range of what?
It needs to be less than 9.56% of the employee's annual income. Okay. Now, there's a few safe harbors that you can use when determining that 9.56%. You can do the federal poverty level just straight across the board,
Okay.
And ensure that the employee's premium is under that. You can take a look at individual employees' previous W-2s, determine what their rate would be based on that. Or just if it's a new employee, take a look at their projected income and base their rate off of that. A lot of the healthcare plans, 9.56% may seem a little low, like, employees really aren't paying that much, but a lot of healthcare plans actually based on employee wages, they do fall within that.
They meet that.
Yes.
Okay, so we've covered employers that employ over 100
That's correct.
full-time equivalent. What about those that are under?
So the 100 full-time equivalent employees have been for 2015. Coming in 2016, that number is reducing down to 50. So if an employer has 50 or more full-time equivalent employees, then they are required to offer health insurance coverage or pay the penalty.
Okay.
So, there's a few businesses, especially that we deal with. We've had a handful
Sure.
that have been over the 100. So coming for 2016, that number dropping down to 50 is very significant because you have a lot of, number one, clients who are already over that number,
Right.
or who are very close and either need to decide, do I want to offer health insurance coverage, or do I really want to closely manage my population to ensure that I stay under that 50?
Right, that just seems like it's kind of getting into something different. I mean, you try to stay under 50 just for a different reason when your business may actually need to be 50 or more.
Right.
Dave, you're being very quiet. We're almost out of time. I know you have something that you want to tell me. I feel it.
Well, the Affordable Care Act we saw this coming when the law was passed some time ago. We saw the compliance issues becoming a challenge to our area and our Destin business community. And so SimpleHR has been developing our internal processes and our software to assist our clients in tracking all the compliance issues and the everything else that's involved in being with under the Affordable Care Act, to be sure that we're able to track the workable hours and then also the filing of the new IRS forms. So I'm proud of our entire staff that they've, Shannon got her certification as a healthcare reform specialist. That was important to us in looking at the Affordable Care Act. It's going to take a lot of employers by surprise in 2016.
Yeah.
And so having a local service, we just feel that that's a very unique opportunity for a lot of our clients and future clients to look at us in tracking the Affordable Care Act.
All right, one quick question because we are out of time. If somebody doesn't use your other services, but they just want help in figuring out, am I under 50 or over 50? I thought I could figure that out because I have 49 employees and a bunch of part-time. Would you do that on like a for fee basis or not? Could you do that?
I think it's a possibility.
Okay.
Our hands are going to be tied really with compliance issues for our
Sure,
clients currently.
sure.
But I think there's certainly an opportunity there that we would want to extend that to those business organizations that would need that additional service.
Okay, all right.
So I think it's possible.
Okay, so you're going to come back next year and we're going to find out how the new changes and how all this is working, right?
Sure.
Thank you so much.
Thank you.
Thank you.
We'll be back.